how does negative stereotype threat impact population health, especially for our underserved populations?
I think there's really kind of two issues that are at play when we're thinking about how negative stereotype threat affects our population. So one is that our patients that are coming from communities that are historically underserved and marginalized from healthcare already have a number of stereotypes depending on their individual identities that are hanging over their heads. For example, stereotypes that I've heard from my own patients, for example, I had a Black patient once tell me that what we as Black people do to get rid of our problems is smoke, drink, and then we die at a young age. So I've had a patient tell me that. And he said that's what's going to happen to me too. When I was talking to him about some of his health behaviors, I've had patients with chronic pain worry about being accused of being drug addicts whenever they interact with healthcare, because they might have a worsening of their pain condition, but then they're worried that if I ask for pain medicines, they're going to think I'm a drug seeker. I serve a community that is very low income. A lot of patients with housing insecurity, food insecurity, that require more financial resources. They already feel a lot of shame about asking for help because they're fearful of being accused of being unnecessarily dependent on the system, and have had their own interactions whenever they interact with people from various agencies, social service agencies, where they felt dismissed or people were frankly rude to them. I've had patients with obesity feel dismissed whenever they bring up their own medical concerns, but it's just attributed to their weight without any further explanation, without any further treatment options. And I've also had a lot of my Black female patients feel a lot of stigma around admitting that they feel emotionally distressed, because there's a fear of breaking that strong Black woman stereotype. And what does it mean for me to admit that I feel weak, I feel vulnerable, and I wanna seek help for myself. So there's so many more stereotypes that are out there, but those are some that I could think of that affected my own patients. That's a tremendous weight to carry, again, once they're actually coming in contact with us. The second thing is that our healthcare system has already done a subpar job of creating equitable care for all. So when you have these negative stereotypes, and we talked about the physiological implications of what that does to somebody who's actually interacting with healthcare once that stereotype threat is activated, and then we're thinking about a healthcare system that is already broken and that does not treat everybody fairly, we have a huge problem. So really, stereotype threat has the potential and has perpetuated healthcare inequities.